Right, I think that says we're good. So I'll begin. Yeah, welcome everyone. My name's Susan van der Ven and I'm chairing the meeting today. I'd like to begin by welcoming those members of the public and press who are watching live stream via the Cambridgeshire County Council website. There's always a risk that we may run into technical problems, and I would ask for your patience if we do. Should this occur, I will declare an adjournment while the fault is addressed, and the public broadcast will be paused. If it's not possible to address the fault, the meeting may be abandoned until such time as it can be reconvened. Can I remind members and officers that all virtual meetings are being recorded and that the recording of this meeting will be published on Cambridgeshire County Council's website. Right, I'll begin by calling the names of all members of the board to establish your presence for the record. Councillor Handley, you can just...
Present.
Thank you. Councillor Howitt. Very good timing. Councillor Howitt is here. So, Councillor Walsh.
Yes, I'm present, thank you.
Charlotte Black.
Yes, I'm here, thank you, Susan.
Adrian Chapman.
Yes, present.
Jyoti Atri. There you are. Gary Howsam.
Present.
Lewis Campher.
Louis sends his apologies, Susan.
Okay, thanks. Jan Thomas.
Yeah, here. Hi, Susan.
Hi. Sandy Smith.
Present, hello.
Hi. And myself, Councillor van der Ven. Thank you. We've received apologies from Councillor Fitzgerald, although I see him here on the screen. So
I am here. Yes,
yeah.
I'm here.
Good to see you.
I'll apologise for being here then. How's that?
Good. We'll add you to the list of those present. And similarly, I think Daryl Preston, Police and Crime Commissioner, has a substitute here today. Jim Haylett.
That's me, thank you.
Great. And Stuart Francis of Health Watch CEO has given his apologies, but we welcome Sandy Smith, who is substituting for him. And finally, we do have apologies from Wendy Ogle-Wellborn.
Can I just note, please, Councillor, that Stuart Francis is our new chair, and I'm the CEO.
Oh, I beg your pardon.
Okay.
I think he's in Spain, looking at his Facebook page.
Okay, and moving on to declarations of interest. Does anyone wish to declare any disclosable pecuniary interest or non-statutory disclosable interest? Okay. Next, we are being asked to approve the notes of the meeting on the 26th of July, 2021 as a correct record. Can I ask if anyone who does not agree with this proposal to use the raised hand function now? Councillor Handley.
Susan, I did send my apologies. They're not recorded. I don't know if there was a problem in the email, but I certainly did send something.
Thank you. I do remember.
Yeah, because I told you, didn't I? Yeah.
Yes. Yes. We'll
Okay.
add that. Anything else? Councillor Walsh.
Sorry, looking for the hand there. Susan, did you mention at the beginning of the meeting that it was not your turn to chair and it was my turn to chair? Because according to the minutes, I did chair the 26th of July.
Yeah, I was going to raise that as a correction, as I think I chaired that meeting, and I think there must have been a typo there. I think you chaired in May and me in July, and we'll revert back to our swapping round. Thank you. So that'd be the second correct. Okay. Any objections to the proposal to approve the notes as a correct record with those amendments? No, so I think we'll take that forward. And now we move to item 3, public questions. I don't believe we received any public questions. Is that correct, Rhiannon?
That is indeed correct, yeah.
Okay, thank you. Right, item 4 is the update on epidemiology from Jyoti. If we can hand over to you, thank you.
Thank you, Councillor Van der Ven. Hopefully you can all see the presentation. I'll just move it to slideshow. Okay, you can see it, yeah?
Yeah.
Great. So this first slide is showing what's happening across our districts. And you'll see that for most areas, the first column is showing the incidence rate per 100,000. We are now above the England average, except for Cambridge. And over the last few weeks, Cambridge has been relatively low, but we're now starting to see an increase in Cambridge too. And you'll see that from the graphs that follow. I think also to note on this particular slide is the rate in the over 60s. That's the third column along, with Finland having a rate of 301 per 100,000 in the over 60s, and Peterborough also having a particularly high rate, as well as East Cambridgeshire. So they're the ones to be particularly concerned about, because we know that our over 60s are more vulnerable to adverse impacts from COVID. This is showing the top 20 lower tier local authorities for their highest rates of COVID. And thankfully, Peterborough isn't in that top 20, but it has been over the last month. It's been in the top 20 for much of the time, actually. It's just dropped out now because of rapidly rising rates in the southwest region. We do appear, however, Peterborough appears in the fastest growing. So this is lower tier local authorities with a rate of increase above 10%. And Peterborough does appear in the top 20 for the fastest growing areas. And also for the over 60s, we'll see that Finland appears in the top 20 for rates in over 60s. This is showing a breakdown by district, and you can see over the last few weeks, so since the beginning of October, there's been a rapid increase in most of our area, with the exception of Cambridge, as I mentioned earlier, but we are starting to see a gradual increase in Cambridge too. Over the last few weeks, there's been a few bumps where there's been a decline and then another rapid increase. So even where we're seeing declines, over the last week, I would be cautious in interpreting that, because they could rise up again. And then it's also worth noting the rise in over 60s, as I've described earlier in Finland and in Peterborough, but also gradual increases in Hunts and East Cambs and South Cambs. This graph shows what rates look like now compared to the peak in January, and you'll see for most areas, overall rates are now higher or very similar to the rates that we saw in January. I think one of the key differences to note is that the separation, the darker orange line is the rates in over 60s. And in the January peak, there's very little difference between the overall rates and the over 60s. So the peak was being driven by rates in over 60s. This time around, we're seeing a clear separation between overall rates and the rates in over 60s. And I think there are two main reasons for that. Firstly, the rise that we're seeing at the moment is being driven by increases in secondary school-aged children. This is entirely in line with predictions. We were expecting that there would be a peak a month or two after schools returned. It's also what we're seeing in Scotland, where schools returned earlier than they did in England. So I think that's one of the reasons why there's a clear separation. The rates are much, much higher in the younger age groups. But the other reason is that those younger age groups have not had the benefit of vaccines. So the over 60s have had, for the most part, it's not entirely true, and you'll see that from a later graph, have benefited from vaccinations. And so we've seen a lesser impact on hospitalizations and deaths this time round. Again, that needs to be interpreted with caution because rates are now starting to increase in the over 50s and the over 60s, and we're seeing outbreaks in care homes again. And I would expect hospitalizations and deaths to rise as case rates rise in older age groups. This is showing the rates in the school age population, and you'll see that the rates have been highest. The darkest line, so the dark green line for Peterborough and the dark blue line for Cambridgeshire, shows the rates in 11 to 17-year-olds, which have been the highest since the summer and on return to schools. We're also now starting to see the next shade of blue and green rise. So that's the rates in 5 to 10-year-olds. So we're seeing increasing incidence in primary school age children. And I'd point out now that we have very few measures to put in place in primary schools and secondary schools. We can apply testing. So they've had regular LFT testing, which has been helpful in catching asymptomatic carriage. They had supervised testing when they returned to school in September. And we've got the vaccination program being rolled out in the 12 to 15-year-olds. 16-year-olds could access vaccinations earlier. We don't have any of those measures available to us in primary school, where rates are currently rising. This has had an impact on how schools have been functioning over the last month. It's been causing havoc in schools. Absence rates are particularly high because of people directly having COVID, but also because teachers have been catching it. It's meant that classes have had to be sent home on occasion where it hasn't been safe to run them because there hasn't been enough adult supervision present. This is showing hospitalization rates, and you can see that there has been a gradual increase in hospitalization rates, mainly in the Peterborough hospitals, but I think there's a growing increase in other areas, and Jan may want to comment on that. I mentioned that it hasn't yet had a major impact on deaths, and there have been 31 deaths that have occurred within 28 days of a positive test in Cambridgeshire since the beginning of September, and 20 in Peterborough. This is showing vaccination coverage, and you can see the red indicates that we are statistically significantly lower than the England average, and for all age groups in Peterborough, we are statistically significantly lower than the England average. And I'd point out the coverage in the 12 to 15-year-olds at 8.9 is significantly lower than the England and East of England average. East of England average is around 23%. And even where we're not statistically significantly lower, we still have large proportions of our population uncovered by vaccination. So in the Cambridge 25 to 39-year-olds, we only have 67.3% coverage. So many people who are starting to get in towards a vulnerable age group still don't have the protection of vaccination. So I'll just stop sharing. So I think in summary, this is a concerning set of circumstances. We have lower than average coverage of vaccination. We have higher than national prevalence of COVID across most of our patch. My team are continuing to manage outbreaks in schools with Jonathan and his team, as well as in care homes and workplace settings. I'm concerned about how this is going to be managed moving forward, with significant impact now on the NHS through a combination of factors. Firstly, the pressure to catch up on electives. Secondly, the direct COVID hospital admissions. And thirdly, through the impact on the workforce, significant parts of our workforce have children, school-aged children, and are either having to stay at home with kids who've got COVID or are catching COVID from their children. And, you know, those three circumstances together are causing serious pressures for our health service. So there's the concern around how we can support the health service to manage those pressures moving forward, how we support school children to stay in school, and how we stop the escalating rise in the older vulnerable age groups coming together. So aside from the outbreak management, I am actively talking to and working with regional colleagues to see what additional measures we can put in place locally to control the spread of infection, keep kids in school, and keep our workforce working and protect our NHS. I'll stop there and I'm happy to take any questions.
Thank you. Thank you very much. And could we also thank your team for the work that they're doing, and everyone here really. If members of the board would like to ask a question or make a comment, could you please use the raised hand function on the screen? Thank you. Bill.
I'm not sure if Jyoti's the right person to ask on this, but do we have any evidence of the sort of the anti-vax brigade having an effect on uptake in our region? I know that that's been reported as happening outside schools, for example, in other parts of the country. I just wondered if we've been suffering from that as well.
I think Adrian may want to respond to that. Adrian, you happy to?
Yes, thank you. The chair's happy. I'll just briefly respond in saying that I think we've certainly seen episodes of anti-vax activity. You mentioned some schools. There's been a couple of small-scale demonstrations linked to some of the community events that we've held, particularly around sports venues. But I'm as confident as I can be that it's had little, if any, effect. It doesn't appear to have put anybody off on the day, certainly not the community protests. And indeed, every time we've put the bus out, for example, we've used the full capacity of the bus's vaccine stock during that session, regardless of whether there's a small demonstration or not. So we're not really picking up any negativity as a result of the very small minority that are protesting in this way. I think you'll be aware of discussions at a national level now around trying to control those kinds of activities in schools, which arguably aren't the right place to be demonstrating. But no, I don't think we're seeing the effect locally.
Thank you.
Thanks. Sandy.
Thank you, Chair. Can I just ask about the booster programme, please, and noting the vulnerability factor of those older age groups, and just wondering if that's being measured and reported on in the same way that the vaccination are, and I'm just aware that arrangements for rolling out the booster vaccinations are different from the first two. So I'm just wondering want to hear a bit more about that, please.
I would probably ask Jan to come in on that if she doesn't mind.
You're on mute, Jan.
There's not a fine for that. So apologies, Sandy. I just don't have been out for a few days, so I don't have the information in front of me right now. But just to be clear, the booster program is very different actually to the first way of working, and that's primarily because it's a timing issue. So people get notified, they then get the opportunity to book in, and there's still walk-ins for those boosters. I'm very happy to pull all of some information together and circulate it round. What we are seeing is some minor confusion between those patients who are immunosuppressed and have a different type of letter, not just for the booster, but actually how they need effectively two jabs going through. We're seeing confusion with how those people navigate through the system, but we're not, and we are seeing less people coming forward for the booster than had 2 doses. But we're just doing the analysis on the gap on that now. So it's not, you know, I don't have the data to hand, but I'm very happy to bring it back.
Thank you. All right, any other questions? We're going to move on to the vaccination uptake, actually. So let's do that now. Adrian Chapman, Director of Communities and Partnerships, please could you introduce the item 5 on vaccination uptake?
Certainly, thank you, Councillor. And I'm going to focus actually on the vaccine confidence work that we continue to deliver. What I will just say first of all, though, is to pay credit to colleagues from the health system that I think we all remain in awe of the operation that's being delivered, ably led by Jan and her team. I'm very much on the periphery of that, and I'm amazed actually by the volumes that we now talk about, and you're rightly picking up the next big challenge, which is booster, but also flu vaccines as well, at a time when the health system itself is really struggling. So I just think it's really important that we remind ourselves of that huge effort, and that the overall programme is very much being led by the CCG. Our role around the vaccine confidence work is to try to address hesitancy and lack of confidence in a minority of people that still aren't prepared or happy to come forwards for various reasons. And I think the stats that Jyoti has shared do mask that incredible effort from both the health system and other partners to try to get maximum saturation of the vaccine uptake. So I just wanted to make that point. So it is a big effort. The vaccine confidence work remains huge. We're in a significant battle rhythm now for the long haul, as we focus still on getting people into first and second doses, and also booster and flu. We're kind of absorbing all of that into the single programme. It is a minority of people now, and there remains through the CCG and its providers, the large-scale bookable sites, walk-in sites, pop-ups, and our bus. We are just in the process of adding a second vehicle because the mobile provision works really well, but it would be a bit smaller, able to get and tuck into streets that perhaps the large vehicle can't get into. So watch this space. We'll reveal that when it arrives. And I would say we're still dealing with 3 forms of hesitancy. There are some people that have had COVID, weren't particularly unwell, or still don't believe in COVID and therefore aren't prepared to get vaccinated. There are some people for whom convenience is an issue, so perhaps they can't travel to a vaccine clinic, they may not have childcare available, or are worried about side effects, and that's a concern, or perhaps are in a 0 hours contract situation and again can't take time out easily. And then by far the majority of people now fall into the confidence category, which is somewhat easier to deal with in many ways. So people that perhaps are worried about myths and rumours that they're picking up, which are valid in their own minds, but actually we need to work with them to try and dispel. So people worried about fertility, people picking up international media that isn't positive about the UK vaccine programme, people worried about side effects, people who are needle phobic even, and those of us that have had the jab will know that the needle is tiny, it's the thinnest needle in the world, and it's really nothing to fear. But if you're needle phobic, it's the biggest needle in the world. So we've just got to work through these issues, and are doing. And as a result, small gains for us are big wins. If we manage to get 20 people that were previously hesitant into a session in a community and to get vaccinated, that's a major victory, and we shouldn't be put off by that scale of small win. That's a big difference for 20 people and their families, and we just need to keep chipping away until we get to where we need to get to. It makes us more determined, really. The approach we're taking really now is based on 3 things. It's aside from the underpinning core offer that Jan and her team are providing, we are providing lots of hyperlocal and mobile provision in the heart of communities or in workplace settings, which are working particularly well. So working with employers to allow their employees to take some time out of their shift to come into a car park to get vaccinated is a particular success. Secondly, short bursts of community engagement activity just immediately prior to a pop-up event. So that's not saturating a whole community and trying to urge them to get vaccinated, because that becomes just wallpaper effectively. Instead, working with the community in a very targeted way on the weeks leading up to an event. And then thirdly, continuing to work with community leaders and faith leaders, also having significant success. And just a few quick examples of the sorts of work that we're doing. I've mentioned the bus a few times. It's particularly successful and effective, and that's delivered well over 9,000 vaccinations since it went on the road a couple of months or so ago. It's particularly successful. Who knows whether those 9,000 people would have made it to a standard clinic, but I would probably assert that many wouldn't, and it certainly provides convenience for a lot of people. We've put that bus in lots of settings, including churches, mosques, gurdwaras, employers, car parks, community centres, and many, many others. And I always make the offer to anybody that will listen, if you have suggestions of where that bus could be located. We plan on a 3-week cycle, so always 3 weeks ahead. It'd be really great to understand where you think there's resistance or hesitancy in your communities, and let me know, and we can try and factor that into the bus timetable. We've still got our 15 community-based workers who are now becoming quite specialist in dealing with vaccine confidence issues. These are 15 workers that were employed, funded by the Contain Outbreak Management Fund, but employed through our fantastic voluntary and community sector partners. So people from within communities that are themselves quite hesitant, and they're working really effectively, getting under the skin of reasons for hesitancy in different parts of our county and in Peterborough, and also representing different faiths and different nationalities. That's particularly successful, and they will continue. Lots of materials, thanks to Christine's exceptional work, translated into multiple languages, both physical material and also social media material. I'm sure Christine will pick up on that later. We've continued to put people through our Making Every Contact Count training. These are people that are in touch with a member of the public as part of their day job for whatever reason, because they themselves can then become champions in promoting the vaccine programme. So giving people a bit of information, a bit of knowledge about what vaccination programme, what it's all about, how safe it is and so on, just enables that conversation that they're having about some other issue to be opened up and broadened out to cover off the vaccine confidence issue. And then the final thing I just wanted to briefly plug, as I always do shamelessly, is the vaccinators.co.uk website. That remains live. It's a cracking tool for anybody to use. It's bang up to date, contains all of the information you need about where clinics are operating for the next few weeks. The county-wide and district hub network remains very much live, and particularly around the themes of convenience, people not able to get to a clinic or people worrying about childcare, for example. We're really keen to help. So if you come across residents or patients or people in your work who might need a bit of help, practical help, then do contact the hub. The number for the record is 0345 045 5219, and also details are available on both the County Council and the Peterborough City Council websites, COVID information pages. And then finally, there is a great tool if anybody wants to drill down into much smaller geographies across our county and in Peterborough, that is kept up to date by the government, available on the coronavirus.data.gov.uk website, which allows you to drill into geographies of around about 6,000 to 8,000 residents, and you can see the level of take up, and that just allows you to focus your own work and own communications in those areas where take up is at its lowest. So excuse the plugs, but really important we keep pushing out those messages. I think that we're here to help. Thank you, Councillor van der Ven.
Thank you very much. Could I just kick off with a couple of questions, please? Could you give a little bit more detail, please, on people who are homebound, and what the plan is there, what's happening there? Elderly isolated who are reluctant to use the transport available. This is anecdotal, but these are the things that we're seeing in our communities and questions that are coming our way. So reluctance to travel with other people, perhaps in community transport. And also, I wonder if you could comment on the availability of vaccine for 12 to 15-year-olds during half term. And may I be so bold as to ask about data sharing and just how will that take up then affect the rollout in secondary schools after half term? Is that a clear path? And I've also picked up questions about official records. What kind of, does the NHS app record the booster? These are the collection of things that seem to be coming our way in the community. Sorry, that's a lot. And then we'll move on to Councillor Howitt.
Thanks, Councillor Van der Ven. I might need, I can see Jan sort of semi-smiling, but she's the expert here. And I'm wondering, Jan, if you might pick up some of those. I can certainly comment on the elderly isolated point by saying that I think this is where that rich community intelligence really needs to be fed into our discussions as a system, because there are other options other than taking people to a clinic, of course, and we completely understand why people might feel hesitant about getting into a vehicle at the moment or using public transport. And the bus is one great example where there's perhaps a heavy predominance of elderly people, for example, outside of a care home setting, which is of course being treated differently, where we can bring the vaccine to people. And as I said, small wins are great gains for us. So I'd definitely be keen to understand geographically where that might work really well. Jan, the other themes are around the homebound cohort, availability of vaccine for 12 to 15-year-olds, data sharing and official records.
Yeah, so some of that I know the answer to be completely honest. When it comes to official records, I probably need to again go away and find out some information. So there's a couple of different groups at the moment that we are thinking about. So obviously the 12 to 15-year-olds, that programme has very much been run through a provider called Hertfordshire Community Services, who have the immunisation contract to do school-age children. Because there were capacity restraints, as you can imagine, that was a school-by-school exercise, making sure that we are going in. Last week, we went live with 12 to 15-year-olds being able to use walk-in facilities and actually go to an alternative so that we could rapidly increase our capacity for the 12 to 15-year-olds. So obviously, we're very mindful of governance, etc., around that. But actually now we've opened up a different channel for people to go and get that rather than just through the first route. And I think that's very positive. I think the next two groups that we are worried about are making sure that we get into all the care home and residential homes to make sure those boosters are delivered. There is a very large programme in place for us to, again, systematically go background to make sure those people in residential nursing homes are getting the boosters. To my knowledge, we were trying to get as many of that booked into before the end of October. I think that will spill over into a bit of November, but we have a plan for every home and when we should be in there to make sure that's a booster, and that's a really vulnerable group that we are focusing on. And again, with the homebound patients who aren't in a nursing and residential home, there are the same vehicles that we used the first time effectively to go in people's homes. There's a combination between our community services provider and GPs. People are being identified. It's all done because it's easier, because when we have their first jab and their second jab, we know exactly when their third one is due. So we can do this in a much more planned way than we could the first time. So Susan, I'm assured that we've got really good plans in place to make sure we're keeping going out on that. I think when it comes to it linking with the app, it does go in your GP records. I'll look to Gary to contradict me on this, but it does go in your GP records. And if you can see your GP records through the NHS app, some practices can, some practices still can't, just to be really clear, then you will see it through that. But I don't believe that stops it coming through on the NHS COVID app, but again, I can take that away. And when it comes to data and privacy, the data is all handled through the GPs, through the records in the same way as every other interaction. So it is as protected as other things. However, I think we've got to, if I can go off at tangent just a second, Susan, I think we need to have a conversation about longer term how we deal with data in the public, because what we've learned through the vaccination programme is using data to really segment and target people that we can help the most has been really, really helpful. So the more that we can work with individuals to make sure we can use their data for good to go in and support them more, I think that's what we've learned from the vaccination programme. It makes a world of difference.
Thank you. Richard, did you want to come in?
Thank you very much. Just on that data point, and bear in mind we're meeting in public, I think we should put on record that I completely agree with what you say, Jan, about long-term lessons. We would urge you and your colleagues support on the short-term possibilities. And Susan's made the point, so I don't feel the need to make it at length. But essentially, we as local authorities have plans, are willing. We believe you want us to do more, but to do more, that data does need to be shared by the primary care networks, and it's not happening. And we should put that on record, and we should use this meeting to urge the obstacles to that happening to be overcome. I'm not asking you to comment further on that, Jan. Hearing it and what we will do afterwards is what's important about that. The question now is this: I put on record again, and we all meet each other regularly, but I am so impressed and overwhelmingly support all of the work that's done in the vaccination programme and the communications by it. We've got some very top people, including people in this meeting, who are applying their absolute minds, energy and talents to this. And any idea that's come up is applied. I'm really impressed by that, and I do want to put that on record. But I think the proper question that we have to ask is, despite those not just best efforts, but superb best efforts, we're all still falling short, the points that Jyoti made. And so that's the conundrum we face, that, are we just destined to have an imperfect set of results because that's sadly what's happening everywhere and what will happen in our own county? Or can we envisage that these efforts will actually make a step change, or there will be a sea change in the results to really drive the numbers up in a significant fashion? And I think we need to be honest and open and self-critical about that, because I think we were having this similar discussion in the same vein a month ago and 2 months ago and 3 months ago. And I think any of the public that's watching us and following us will know that. And so it's better to be honest about why we're not able to make more progress. And I hope the way that I've put that is put in a very positive and constructive way, because that is certainly my intention.
Thank you, Richard. Adrian or Jyoti, do you want to respond?
If I may, thank you, Councillor Howitt. First of all, those comments are really appreciated. It sometimes does feel like a never-ending circle that we're on. But actually, that's why I keep reminding everybody of the small wins, which are big gains for us. I think they're really important. And I think whilst we carry on having small wins, then I think we must carry on with the effort. I think I liken it, although it's completely different in many ways, to other behavioural change programmes, actually, which often take years to take effect. If you think back to drink driving or the seatbelt campaigns, it took a long time for those to become normalised. And we haven't got long, but actually this is a marathon. And actually we have to accept that for a lot of people, particularly those that are really hesitant for whatever reason, they are in the deeply entrenched camp, really. Are the toughest people to work with because they've got such fixed views. But we are still making progress. I think if I was reporting today that we weren't seeing any improvements, I would absolutely be with you in saying, look, we have to accept that we're going to be in this situation in the same way that we've accepted there will be an element of COVID in our lives, probably in perpetuity. It's just going to be one of those things we have to learn to live with. But for me right now, and I think for our partners, it feels like we are still making progress. I wish there was a silver bullet here that would just cut through some of the myths, because I think that's our biggest problem actually, is just trying to continually convince people not to believe everything they're picking up on social media. That's our biggest real challenge, I think. But I think we hold our nerve for now and keep the fight on and you know, stay with it. And partners are still contributing very actively. They're still turning up in droves to the meetings. So my sense is, as a system, we're really with this.
Yeah. Jyoti, did you want to comment?
I would just say I think we've learned a lot, haven't we, over the last 6 months about what makes people go for vaccinations, what the barriers are, and we've got more vaccination to come. You know, this is going to be an annual program, so hopefully in the next round we'll build on that learning that we've got already and hopefully be in a better position each time, although it will become more challenging because people are fatigued.
Yeah,
you know, they're tired of vaccinations.
I wonder if it's worth just before I move to you, Sandy, just reflecting on Richard's comments, the fact that the efforts since September, of course, have been against a backdrop of you know, pre-COVID behavior in schools, I suppose. You know, the absence of the sorts of protections that we'd had before, and that's a disadvantage. So just to note that, really, the additional challenge, which of course has now been rectified somewhat. Sandy, would you like to come in?
Thank you. Yes, just to say thank you for your comments about honest conversations, Councillor Hewitt. I think that's what people tell us they want is honest conversations. They want to know exactly where they are, what they've got to do, what the expectation is, and clarity. So thank you for that. And I just say we have had quite a lot of feedback in the past about data sharing as well. And absolutely, when the public understand what the data sharing is for and what the purpose of it is, and there's really, again, it's clarity. So when there's a clear purpose explained to people what their data is going to be for, and possibly more importantly what it isn't going to be used for, they're really happy to share it. And I think that's possibly what we haven't seen before. When there's been data sharing proposals from central government, they have come down, dare I say, kind of like with not a lot of clarity when they land on people's doormats in the form of a bit of a misleading leaflet. So that'd be really helpful. And I'd just like to say thank you to colleagues at the CCG, particularly because we have had a lot of queries about people that are housebound and haven't had vaccination and want them, and we've had everything resolved really quickly. So thank you to you, and also thank you to colleagues in CCG and at the local authority for the comms. So really good quality comms, and sometimes it hasn't been helpful about the confusing messages again that have come from central government that I've actually directly conflicted with the local messages. And so it's been great, Christine and colleagues, that we've been able to get clear messages out to local people.
Thank you very much, Sandy. I don't see any other hands raised on this item. Are there any other questions for Adrian on vaccination uptake? So I think that moves us very nicely on to Christine's update on comms. If we could, Christine, if you would like to introduce the next item, thank you.
Certainly. I'm sorry, I'm having a bit of a problem with connection this afternoon, so I will turn my camera off, so make sure that you can actually hear me. So just picking up actually just a bit before I go into my update on the conflicting messages. I think one of the things that we have learnt through the course of the last getting on for 2 years now is that while there are messages that float around on social media which are not helpful to us, it's the trusted nature of the people who are giving them the messages which is the most important thing. So whilst we have been putting up a fair amount of information out through the councils and through our partners, what is really important is when members pick it up, when community champions pick this information up, the work that we've done with Adrian's community reference group, who have been using these same messages, the videos that we produce on their own individual WhatsApp groups. That is the best way to counter some of those messages, is getting the information from bodies that you trust, from people that you trust. So we've been, making that information. It's not always shared from our own sites, but it goes to so many people, and we are so very grateful for everybody who is sharing, putting that information out. So just to take you over the work that we've been doing since the summer, since we last met, and what is planned for the future. We have done a considerable amount of work on new toolkits, which we've been publicising numbers, because actually one of the important things that people wanted to see was, what does the situation look like in my area? So we have been putting that information out to members on our social media sites, to the community reference group, so they can understand and take their own view of what the risks might be in their own areas, because obviously with a removal of quite a lot of restrictions, people need to know what the current situation is. We've made specific toolkits that have gone alongside particular events. So a lot of work on the lead up to half term. We've got quite a lot of stuff going out at the moment about Halloween. We're working on things around Diwali, around bonfire night events. Christmas and New Year will be coming up as well. How to do all of these things, and in the way that we've always done, how you can continue to live your life but live it safely. Because we do know from behavioural science that telling people not to do things is the surest way to get them to think of a way around it. What we want to do is give them ways and suggestions of how they can do these things in the most safest possible way. We've been working very closely, as both Adrian and Jyoti have mentioned, specifically working with workplaces. So we've had a whole series of workplace campaigns looking at particular high-risk workplace areas. So distribution, pick and pack type things, care homes, and also hospitality. So very direct campaigns that have gone into those workplaces and supported then the vaccination bus and the particular work around workplaces that Val and the workplace cell have been doing. And we've also been doing a lot of work with our CCG colleagues around vaccination support, and with Adrian's team with looking at particularly some general information, obviously publicising the Vaccinators on Tour, which is a fantastic website. And again, if it hasn't been publicised enough on this broadcast, I'd like to say again, Vaccinators on Tour is really a very good vaccinators.co.uk. Can't remember. Yes, that's the one. You need to go, because that's where it's updated every week. We've been a lot of support for that. But what we're also doing is very specific, dedicated information. So when Adrian was talking about those very small wins, what we're looking at is the very practical things that we know will get those final few people across the line, people who are hesitant, not resistant. So we've been doing work around travel, so the new restrictions on travel, which are particularly things that we had heard from younger people and from our Eastern European communities might be a reason why they might go and get vaccinated. And we're not proud at this point. We'll get people vaccinated for any particular reason. It's most important that they do it. And so we've been doing that. The other things that we have been particularly working on to launch quite soon is as a refresh of our campaign working into the autumn and winter. And this is going to form around a sort of a pledge which says this is what we are doing as the local public sector about making vaccinations as easy as possible, to get all of the transport information that Adrian is talking about, all of the, the additional buses, the work that Jan's team are doing on making sure that the vaccination points are open at different points, and talk you through the information about testing, how you get it, where you get it, why it's important, and the support that we give you around good public health advice. But then what we want residents to pledge to do as well. And so the residents' pledge is to get their vaccination, not just their 2 COVID vaccinations, but their booster vaccination and their flu vaccination when it's offered to them, and that they will test regularly, and particularly before they go to events where maybe more vulnerable people will be, or where it's more crowded, or where they may be with other people, that they will observe the good public health guidance. So we are planning to launch that in the next couple of weeks, and we are looking for support from local, well-known local people, obviously from our doctors, from our fire brigades, from our police, from all of our public sector partners. And it's something that we've been talking about in SCG, and we also talked through the Warn and Inform Communications Cell, and we will have some materials for that soon, which we are hoping that people will help and support us, because all we've got now really is to work on, the information, and we've got some very clear information about how successful the vaccination programme is, about breaking that link between serious illness and we can see it very clearly in the slides that Jyoti showed us. We've got more infographics of that sort coming up soon. I think having, informative, well-respected people like Dr. Gary Howsam and Jyoti, and people who people really believe, talking about the effectiveness of this, and we will continue to do that work, but also having community leaders like yourselves, like people from the faith communities, like respected bosses from big companies speaking out is really important, and we will continue to do that work as well. Happy to take any questions.
Great. Thank you very much, Christine. And also thank you for the very hard work your team has been doing. I know last week you were doing something different every 5 minutes, and fielding many, many queries. Does anyone have any questions? We've all probably been feeding into Christine's team to produce, to contribute to your portfolio of communications. So we'll just need to keep that coming. Okay. All right. I guess we will, if there are no questions, then we will move on to the final item, which is the economy impact. And could I invite Val Thomas or Jyoti Atri to introduce this item, please?
I think we've pretty much covered it in my presentation. Val, you might have more to add from a workforce perspective.
Yes, I think you very well described how the situation in schools has spread out into workplaces, to a working age population. And that's become, obviously reflects a widespread community transmission, but how that's playing out in the workplaces has become, it's a very different pattern from what we've seen previously in workplaces, where we would see in previous surges, large outbreaks, 20, 30, 40 people in a medium-sized workplace. What we are seeing now is a huge number of workplaces. In the past week, we've added over 350 new workplaces with small numbers, but we're monitoring how the size of those numbers are growing. So from -5 to 5 to 10 and +10, and that's creeping up as well. Talking to, and mindful of the fact that these are quite widespread across a lot of sectors, but there's a lot of them in those infrastructure. So the food factories, the utilities as well as through the sort of leisure and recreation areas. But also in those areas, particularly in some of those infrastructure sectors, there are lower vaccination rates. So that there's a concern there as well. Feedback from employers, I speak to myself, but also from environmental health staff and from economic development officers in the district. It's a context in which employers find themselves in terms of the financial pressures associated with things like energy costs, the labour shortages, and we're having quite acute coming up to Christmas as a lot of temporary staff are recruited. And again, the supply chain issues and those issues which I think are probably well documented, but it's creating a general stress in workplaces. The knock-on effect of that is that getting those messages through about the COVID control measures, the importance of testing and so forth, become more challenging in effect. And these are the messages that we are working with employers on, as Christine has mentioned, but more on a certainly the environmental health staff are working very hard, and members of the public health team, whenever we take the opportunity to have that discussion with employers about the importance to maintain the types of measures that they have really know very well. And I pay credit to employers. In fact, most employers, you don't really have to talk to them about the measures they should be taking. They know what affects transmission, whether that's small or big employer. But these pressures that they find themselves at the moment, and that continuous theme of uncertainty about what's going to happen next, are we going to move to more stringent national measures, or create that air of uncertainty and stress?
Okay. Thank you, Val. I know we hear this in multiple meetings, but would it be worth bringing in just a note on the impact on the workplace in the health service at this moment, and including our GP surgeries, just for the benefit of a public meeting?
do you want me to start on that, Gary, and then you can talk from primary care? Would that be so? So as it stands today, if I give a bit of a general update, as it stands today, we are still seeing the numbers in the hospitals increasing, and we are currently up to 133 patients in hospital beds. That was as of first thing this morning. Alongside that, the occupancy rates at the hospital is still very high. So Addenbrooke's is at 100% occupancy, and Peterborough is at 99% occupancy, and Hinchinbrook has a couple of percentage points just below 100%. So it is incredibly busy. The combination of staff sickness and a level of fatigue isn't.
Do you want me to step in with the primary care update? So I think there's several messages we'd give from a general practice point of view. First of all is that general practice is and has remained open throughout the pandemic, and that's a really important message to get across to the public. At the start of the pandemic, we were instructed to operate in different ways in order to maintain the safety of patients, our staff and ourselves, which meant largely telephone triage before people were invited down to the surgeries, where that led to a clinical value add to the consultation. We know we dropped from about 80% of appointments in GP surgeries being face-to-face to a level around 20 to 30%, but that's now swung back up to about 65%, which I think is probably a right sort of balance, which reflects the different needs of different members of the population in terms of convenience, ability to get to the surgery, and those that are also still very afraid to come out because of the risk of catching infection. We're actually offering more appointments in general practice across Cambridgeshire and Peterborough than we did pre-pandemic by a factor of about an additional 11%. We've got several different work streams that GPs and our teams are involved in at the moment. We've got what I'd call business as usual, so all the stuff that GPs would normally be doing, and we're seeing the usual ramp up in activity because of winter pressures, and that's viral illnesses, not just COVID, but the usual ones you'd expect to be circulating. We've increasingly involved in the ongoing care of people who are sitting on waiting lists for hospital services, and that's putting an increasing demand on general practice. We are also heavily engaged in the flu campaign for the last few weeks, and the next few weeks we'll be heavily engaged in ensuring that an expanded number of people in the population who are eligible for the flu campaign this year, which will be the biggest flu campaign ever, are making sure we get those jabs into people's arms as soon as possible. We're also struggling with staff issues. We're seeing staff away because of COVID related issues. We're also seeing staff away through stress and just general tiredness now. They've been working exceedingly hard for the last couple of years, and we're starting to see a level of attrition on staff. And that's not just clinical staff, that's our admin staff and front of house staff, who are equally as important to our operating capability. And the other thing that I think I must say on a public meeting is the level of abuse and challenge that is being directed towards all members of the general practice team, which is both worrying but also really quite unacceptable, because everybody I know in general practice services, indeed all care and health services across the county, are working as hard as they can within the constraints that we're finding ourselves in at the moment. So that's probably a brief roundup of where primary care's at, and general practice in particular is at the moment. And hopefully Jan's phone stopped ringing.
Yes, apologies about that. It only took 21 months for that to happen, didn't it? The phone to go. So just picking up, so as I said, COVID numbers in the hospitals are rising, occupancy is high, busyness is high, but also, as I said, staff are not only unwell, but also there is a level of fatigue, which we've talked about before, which means that filling of additional shifts and people doing work on top of their usual work to support those times of surge is more difficult, and we completely understand that. So there is a series of activities going on to make sure that staff feel recognised, that we can support people as much as possible, offer some a high level of flexibility, However, I think a workforce, if people say to me, what's the biggest risk over winter? A workforce across the patch is really difficult. And Gary's absolutely right. If we think this is just about hospitals, it isn't. When I speak to colleagues in our mental health services, they've got the same problems there as well, as we have in primary care. And I know in the care sector as well is also struggling, which is now well documented. So concerted effort around workforce is certainly one of my key priorities at the moment.
Okay, thank you. And thank you also for making us aware of the Be Kind campaign, which is something to promote along with everything else. Richard, sorry, I didn't see your hand up earlier. Would you like to come in?
No worry. I think we're close to time, so I'll speak quickly. But I have got two big points. One is in response to what Gary says. Thank you for being so candid with us. And I just think we have a role as well to be responsible. And when you hear that, it's utterly shocking to think that our NHS staff at any level are subject to abuse and criticism. So I think we should, in the minutes of this meeting, record our utter condemnation of that. And I think, although I echo what you said, Susan, about the Be Kind campaign, I do think we should ask Christine and our communications effort to do something at some point before too long that draws attention to this and challenges it and makes quite clear our own view about that. The second thing is this, and I've said it in a number of meetings, the problem that we have is that the people in this call are people who are absolutely yourselves working flat out in managing COVID and dealing with all the issues that we've been talking about. But there is a need to work on plans for COVID recovery, and it is one that certainly our council is absolutely committed to. It's not reasonable to get the people on this call to say you've got to do this as well, actually, in my view, right? But I do think we need to charge some people somewhere in our organisations, and certainly I can only speak within the county council, to actually start thinking about that, who've got some space to think about it, because recovery will come. All of the discussion in this meeting has been about what happens in workplaces to keep people safe, and if there's further absences to do with outbreaks and what are the consequences. They're not about how companies are going to recover and our economy recovers. And we do need some different people thinking about that and looking at that. So again, I hope if other people agree that that can be a conclusion in this meeting, and we need to think who are the right people in our organisations to be charging with that task. But I think it's not responsible for us to not also be thinking about that at this time.
Thank you very much. And I see Val nodding there. So that's something to take away from this meeting. So thank you very much. And also for your comments on well, I'll call it the Be Kind campaign, but it is a shocking thing that there needs to be a Be Kind campaign for the same people we were out, clapping for at the beginning of the pandemic. It's very bewildering that things have changed. Although, it's a funny time. We'll note that in the minutes then, but with all of your agreements. Oh, Jan, I see your hand up. Did you want to come back?
Yeah, sorry, I just wanted to comment on that point about recovery by Councillor Howitt. So as part of the SEG, which is the central coordination group we do for the emergency first line response, we have identified this as an issue under the leadership of Liz Watts and Joe Lancaster. They have been doing a piece of work on recovery, and I think the point is well made. We need to start linking some of their work, making sure we understand what that is and how that's working in with the what we're going to be doing over the next few months. But I think that has been identified now. You've just made me aware, Councillor Howitt, that we're not necessarily linking that up, and I'm sure between those of us that sit on SCG and this group, we can work out how we cross-fertilise.
Good. That seems a really constructive note on which to bring the meeting to a close, because I think we have come to time. Although we do have an any other business item, if anybody does have any other business. Don't see any other hands up. Okay. All right. In that case, may I thank you all for coming, and also please could we reiterate our thanks to all of you and the people that you represent for everything you're doing at this incredible time. So thank you. And I declare the meeting closed.